Hi, my name is Jonathan, and I'm here with the hope that after watching this video, you'll have a better understanding of physical therapy. Right now, I'm in one of the lab rooms of the physical therapy department here at Northern Arizona University, hooked into one of the devices that they use to help reteach patients how to walk. To begin, I'd like to go to the downtown area and talk to a few people to find out what they know about physical therapy, as well as do the same with students back here at NAU, and this will help gauge what is commonly understood about the field of physical therapy. Then, I would like to speak to the faculty here at Northern Arizona University PT Department to find out what they feel are important aspects of physical therapy for the public to know about. So sit back, relax, and hopefully learn something about physical therapy. And for those of you who are wondering, no, this is not set up correctly, and yes, it does hurt.
I thought it's more of a massage thing, but I realized it's more now instruction about how to deal with the injury and how to use exercises. I thought it's all about my physical therapist who gonna do most of the work, but after doing it I felt like there's a big part or big responsibility. Depends on it's my responsibility.
It's a place you go when you're hurt to get better.
All right, how about you?
Yes, they help you if you have an injured spot. They help you rehabilitate that spot.
I think if you get an injury, it's a great thing. I think you should try physical therapy sometimes before people try when they manipulate your spine, chiropractic. So okay. I'm a firm believer in physical therapy.
I know that the physical therapist works with muscles and injuries and those sort of things.
I just know that it's kind of like a doctor where it helps to recover people's muscles and help them get back to where they should be by moving and just building up their muscles.
I know that physical therapy is really helpful to a lot of patients. It can do a lot of things. There's a lot of different areas that, a lot of people think it's just physical, and it can be a mental thing too. A physical therapist has a lot of power as far as motivationally goes. They can really help their patients recover a lot faster with an encouraging attitude and with just giving them the right exercises and the right tools that fit that specific person.
All right, great.
Education for those wanting to become a physical therapist now are at a doctoral level. So they graduate from any of the programs in the United States to the Doctor of Physical Therapy. This is typically a 3-year program. So here at NAU, it's 33 months of training with extensive background in anatomy and physiology, exercise, the diagnosis of individual problems, either because of disease or injury, and developing detailed exercise programs, treatment programs that will help them overcome any problems they might have because of that disease or because of an injury.
I guess the number one thing that I'd like the public to be aware of is that physical therapists do have something to offer in the emergency room setting. Many people, including physical therapists who haven't worked in this setting, have a hard time envisioning what types of services a physical therapist could offer. And they can offer quite a few, because in reality the people that visit the emergency department don't have that many different types of diagnoses than the types of patients that physical therapists see in other settings. There's a really high volume of individuals with musculoskeletal problems. There are individuals with problems associated with vertigo. There's individuals who are experiencing falls, and then, of course, there are people that come to the emergency department that have balance and safety issues that need the assessment of a physical therapist to see if they're safe to return to their home setting or if there's another destination that would be appropriate.
The general healthy public need to be aware of the fact that exercise is neuroprotective. So they need to be out there exercising at moderate to intensive levels in order to protect their brain from diseases like Parkinson's, Alzheimer's, and stroke, and things like that. So please eat well and go out and exercise. It will protect your brain from diseases that you will acquire later in life.
Well, I think that knowing that heart disease is the #1 killer of people in the United States, and COPD is certainly in the top 5, that physical therapists can play an integral role in exercise and preventing these two conditions, and also helping people once they have those. Exercise is one of the best things that can be done for both of these, and physical therapists can certainly help you with making sure that you're as healthy as possible with or without heart or lung disease.
Two of the concerns that everybody is worried about when working with the elderly are #1, fall prevention. So everything from home modifications to balance retraining to strength training will help reduce an individual's chance of falling. And the other thing, of course, is bone health. So elderly people today need to know where they stand as far as their bone health. And there are measures they can take to increase their bone density and therefore decrease their chance for fractures and disability related to pain from fractures.
Well, I think physical therapists contribute some really unique skills that there's a great need for in society. Physical therapists can really help with getting people active, helping people to stay active, preventing people from developing additional complications if they have a certain condition. There's a really great need in society. A lot of people really want to be active, but they don't really know who to go to. I think a physical therapist is really underutilized and can really contribute in that aspect. And in addition to that, have knowledge on how to manage people who have these medical issues.
I don't think many people realize that at end of life, many people, most people, still have the desire to be active as possible within whatever limitations their disease process is imposing on them. So with that in mind, physical therapist has a huge role in allowing patients to be safe, teaching family members how to keep them safe and to keep themselves safe. I can give you an example if
Sure.
that would help. And I had a person that asked for my services in hospice because he had the desire to be able to walk from his bedroom to his dining room table in order to have Thanksgiving with his family. But he was unsure about how to do that safely. So I went in twice and worked with him on standing balance and walking and endurance enough to get him able to do that. And he was able to sit at the table like he always had with his family for his last Thanksgiving.
Well, you know, whenever I'm talking to patients or just individuals in the community, or even if a new physician comes into town and I want to give them an idea of what I do and what physical therapy is about, I always come back to improving physical function. And then from there, you're able to describe all of the subcategories under improving physical function. So maybe that's improving someone's strength, maybe that's improving someone's motion or mobility. Maybe it's improving their cardiovascular function. Maybe it's improving their balance. But everything comes back to that concept of physical function, and that's what we're in the business of doing. We evaluate to see where the problems are, the deficits are, the limitations someone has in physical function, and then I think we have a special skill set to address those problems.
Thanks for watching. If you have further questions about physical therapy, go to moveforwardpt.com, where you can find out about physical physical therapists in your area, and even ask questions online that can be answered by physical therapists. I hope that you've enjoyed learning about the different areas of physical therapy. This is Jonathan saying stay healthy.